So, finally, I wanted to say in terms of logistics, we only have an hour together tonight, and we know that we have so many participants that have different experiences and perspectives. I mentioned earlier that we'll be focusing largely on older adults tonight. And so, in fact, a lot of the people who registered are older adults, but we know there are also many people here who are adult children or people who just care about older adults. So, I did want to say that we won't be able to get to every nuance of the complex set of aging topics that are raised. We do hope that you'll come away with ideas and resources to follow up so you can get the support that you need for your particular situation. So let's get started. I just wanted to give a little bit of context for those of you who are unfamiliar. Jewish Family and Children's Service, or JFNCS, is a human services agency that supports individuals and families of all faiths and backgrounds through life's challenging challenges with compassionate and professional care. Within JFNCS, our division here helps older adults and their families navigate aging-related transitions, whether that's staying safely at home, understanding memory changes, planning for future needs, or reducing caregiver stress. So every day, our senior direct helpline gets calls from older adults, family members, neighbors, and friends asking for information and support related to aging. Ask Edie is our new conversation responding to some of the most frequently heard questions through Senior Direct. And so tonight we're going to be addressing this letter. So if we can just put up that letter to show everyone. Great, thank you. So the letter we're going to be addressing is this. Dear Edie, I've always been an active person, but it's been difficult since my wife passed away 3 years ago. I was diagnosed with Parkinson's just before she died. I'm 75. I'm coping with the grief, although of course I miss her. I'm keeping up with food shopping, maintenance of the house and the car, etc. I didn't expect the emptiness in the house. It seems that our friends were other couples or my colleagues from work, and everyone has drifted away, or they have their own problems. The tremors and stiffness are manageable, but frankly make it difficult to get out. This is hard to admit, but I need some people to spend time with and to do something useful. Sitting in the house so much is not going well. Signed, Searching for Companionship. Thank you for, you can put the letter down now. Thanks. This letter touches on so many experiences that we hear about regularly. It touches on grief, loneliness, changes in health, and the quiet loss of connection that can follow from any of those. And so today, I'm lucky to be joined by three wonderful colleagues and aging experts, Allison Berry, Ann Muskoff, and Melissa Norman, who are going to help us think through how to respond with compassion and practical ideas to that letter, as well as to the questions that were raised by those of you who registered. So Allison, Ann, and Melissa, if you could turn on your cameras, please, and join us. Thank you. Great. And you can come off mute as well. Let me just do quick introductions. First, Allison Berry is the director of the Betty Ann Greenbaum Miller Center for Jewish Healing. Before joining JFNCS, Allison served for decades as a congregational rabbi in the greater Boston area. Ann Muskoff, next, is the program director for our Ocano Parkinson's Family Support Program, and she's an occupational therapist with prior experience in home health care. And finally, we're joined by Melissa Norman, who is an aging life care manager with Your Elder Experts and is a licensed independent clinical social worker, or LICSW, with experience in both home care and assisted living and memory care communities. So welcome to all of you. Thanks for being here. So let's jump in by having me ask each of you kind of what stands out most in this letter. And if it's okay, Allison, let's start with you.
Absolutely. And it's really great to be here with everybody tonight and my really incredible colleagues as well. So as we read through the letter again, and I've seen it before, what really calls out to me is just the level of loneliness that this man is experiencing. His whole life has just been upended. It's not only the terrible loss of his wife, but clearly, if his job was a nexus or a hub for his social life, if getting out and being active in the community was important to him, all of these things, especially with the Parkinson's and the loss of his partner, are just so hard. And so right away, I think about what are ways that he can receive support and find a purpose. In new ways. I also think about, and I think maybe Melissa will address this much more fully. I think about his mental well-being and making sure that he has the mental health support that he needs. And alongside that, bereavement support, losing a life partner is just so incredibly difficult and challenging. And so knowing all those things, it's not easy. The other question I would ask and have that isn't answered in the letter is his facility with technology. Knowing that too, we see so many older adults now engaging in different ways online. I would want to ask a lot of questions about that as well. But that's for now. And so I'll turn it back over to Renee and my other colleagues as they take a look as well.
Great. Thanks for highlighting those issues. Let's turn to you, Anne.
Thanks a lot. I would say three main things. Like first, as an occupational therapist or OT, I pick up on the phrases he used, like I was always an active person and I need to do something useful, because we often tie our identity with what we do. But I'm equally interested in, his occupations or activities of daily living, as well as his social life for, like a holistic wellness, because we're human beings, not just human doings. Um, Second, I'm mentally noting that he's, continuing to shop and care for his house, but I wonder about the energy it takes for him to do that and if he's safe to do it. Again, as an OT, I think house maintenance, and then I think ladders, and that's a very scary thought for an OT. And finally, of course, I'm thinking about his Parkinson's diagnosis. So how is he functioning? How is he planning for his future? And along with that, there are a lot of non-motor symptoms that may be barriers or challenges to getting out. Things like, soft voice, even bathroom issues, and motivation tied to the mental health and grief. And so I'm really trying to look at the big picture and all the factors that are in play here.
Great. Okay, thank you. That was a lot, and we'll get to all of those things. But let me turn to Melissa next to see what issues that she spotted here.
Yeah, so the letter doesn't say anything about what kind of support he has. I'm wondering if he has kids that live nearby, or nieces or nephews, or friends, or other community supports. It's really important to age with others. So I want to know that. I want to know if he's had any therapy or sought any support for his grief, which is really important. And what kind of planning has he done on his own now that he's on his own? And I want to know if he's thought about meeting with a aging life care manager.
Great. Again, all a bunch of issues, all good ones, very meaty, and we'll get to most of those. So thank you all for giving us that sort of overview. Obviously, again, many issues, many of which I might know were also flagged by participants independently when they register for the webinar. So let's start with the one that seemed to sort of stand out most, at least initially, and that's the one of loneliness or social isolation. And maybe, Melissa, if we can start with you as a LICSW and aging life care manager, what advice might you have for the writer and for other people who raise similar concerns about this issue of loneliness?
Yeah, so it's been, I think, 3 years since his wife passed,
That's right.
which is a while. And, the fact that he's still isolated and is still grieving, gives me pause. So I want to know, has he had an assessment from both, a mental health assessment, but also from his doctor? And I'm questioning, is he having issues sleeping? Or is he sleeping too much? Is he taking his medication on time? Is he getting exercise? Is he remembering to take his medications? I think I said that a doctor can be a great partner to address the toll that grief takes on your body. So it's important that he sees a doctor. And then he should definitely connect with someone who can assess his mental health. And it can be an aging life care manager, or it could be a therapist. And I want to know if the symptoms of his sort of depression, does it go beyond normal grieving, or has this been going on for a long time? I want to connect him to the right resources. And I want to know, has he explored any resources? It's important to see what's going on at senior centers, join a gym, check out an adult education program. There's something called village models, where you can join sort of a local community and do activities. Has he explored any of this? And he may have challenges getting to events. Does he drive? Is he comfortable driving? Is he safe driving? Does he know how to access Uber or Lyft? Does he have technology challenges that could make, joining a Zoom difficult for him? Can he see? Has he had his, eyes tested and his hearing tested? And I think, does he feel useful? I think finding purpose is really important. So I think connecting with someone like an aging life care manager could really help him kind of come up with a plan.
Thanks,
and
Melissa.
to find others that are in the same boat too, and join maybe a grief support group.
I see. Wait, I sort of interrupted you. Can you say that one more time? You were
Yeah,
talking
so
about others who are in the same boat?
finding others, like has he had, an opportunity to explore his grief with others? Has he joined a support group?
Got it. Thank you. And Allison alluded to that earlier, so maybe we'll get to that in a little bit. And maybe you want to talk a little bit more about this this issue of loneliness or isolation.
Yeah. So, when I talk to people for information and referral, I usually emphasize two things. One is exercise for Parkinson's, but really also socialization, because they're both critical to well-being with Parkinson's. And these are even supported by scientific literature. So I'd be willing to guess that he put some of his needs aside when, he was caring for his wife. I don't know, the circumstances, of course, but chances are he didn't really think much about it. So really, I think about things from a community support lens and how community supports are so critical to linking medical care and daily functioning. They can help someone stay active and engaged and give them support. And especially in the world of Parkinson's, I think they're helpful for being in a safe space. Simply put, people get it. You don't have to explain anything in those kinds of spaces. So just, anecdotally, we have a group called the Tremble Clefs, and, we have a member who, is not a support group person in his own words, but he says just going there and singing in this chorus is a support to him. Another member is not married, and he had a surgery, and the other members, checked in on him after the surgery, and he built a support out of that group because they all understood. I'd also add that the literature supports therapeutic arts and creative engagement uniquely for developing bonds. There are studies that show that singing together in a group, it helps with that and brings that bond instead of just doing a solo or karaoke or something like that. So it's beneficial for mental health. But, in my role, I help people connect with what they need, whether it's a support group, an exercise group, a therapeutic arts group, such as we offer, etc. And I just end with saying that, even for people without Parkinson's, there are a lot of great opportunities. Melissa just mentioned a few of them, things like, councils on aging or senior centers often have a very full calendar, and, faith communities, neighborhood groups, etc. So, thinking about what are the barriers to participating in those things and how can you get around those? So is it, a matter of just calling ahead and finding out more about the program and finding out if it's accessible, how are the bathrooms, all that sort of thing, finding a buddy to go with, even putting it on a calendar like you would a doctor's appointment and making it, something you need to go to are all helpful things for starting that, process. And lastly, I'll just say that I really think it's important that we try things more than once. Of course, we want people to feel safe and supported, but it takes time to learn new things. No one's great at it the first time they try it. And relationships really do take time, and you need to have multiple, contacts to develop that. So I'd encourage him, the writer, to try something a few times before he really makes up his mind if that's for him.
Great. Thanks for all of that. Allison, did you want to jump in?
Sure. So I think I'm going to share more about the grief part of what's happening for him in a little bit. So we're sort of separating out that loneliness and grief question.
Yeah.
But I think applicable to both. I think one of the things I would ask anybody who would come and sit with me is do you have people in your life that you can truly talk to? Because I think a lot of us, a lot of the time, wear masks, right? We don't want to burden others. We don't want others to feel badly for us. If we have children or younger people who have very busy lives who are caring for us, we don't want to be in their way. And so sometimes we just sit with that loneliness, and we have nowhere else to put it. And sometimes we don't even need somebody to solve a problem for us, but we just need a safe space where we can be heard, or a safe person, even outside of therapy, just someone in our life where they're able to sit with our hurt and our loneliness and our fear. I think I go exactly to where Melissa and Anne also go, to say what types of community support can we figure out for this person? Where can we get him some help, and some places to go or some purpose every day? And if getting out is hard, can we get him trained on Zoom to be able to access community digitally, for example? But I even think about the fact, even if he's not so much of a joiner, I was at the Newton Senior Center meeting somebody 2 weeks ago, and they now have a cafe. So even just sitting in the cafe, having a little something to eat, the buzz around him, feeling a little less alone because he's not sitting in the house as much as he's physically able. And so a lot of similar things to what Melissa and Anne said, and we'll talk about grief in a bit.
Yeah, we'll get there in just a sec. I did want to just call out that, you mentioned the issue of people feeling as though they don't want to burden their children or their friends over and over. And that was something we heard a lot in questions that were submitted ahead of time. So I
Yes.
appreciate you raising that. So let's jump into the issue that you just named, grief. So that was obviously a major theme here and major theme of what we've talked about so far, and what we heard about in the questions submitted ahead of time. So how do you think about grief that is kind of persisting in this quieter, ongoing way? He's 3 years out. It's maybe not acute, but it's still deeply present. Maybe somebody feels like they should be further along in their grief at this point. And so, Allison, maybe, would love to have you address this and give some experience from your facilitation of bereavement groups about how can people kind of rebuild meaning or purpose after the loss of a spouse.
And it's such a difficult thing. I think the first piece is to say that in American society, we don't like talking about death. We don't like talking about loss. And a lot of the messaging that we get is, a month goes by after the loss of your spouse, and people might say to you, you're not feeling better yet. Or you're bringing me down because you're so sad all the time. And so then maybe the phone calls stop, or the invitations to go out stop, that initially there's a flurry in the beginning. And then after that first year, which is incredibly hard year, you're still kind of, maybe you're finding you're sitting alone in a different kind of way, thinking now what, on every level. And so I think the first thing I would say is that really grief has no timeline. Different than support for mental illness and mental health challenges, grief continues. It's just then what do we do with it? How do we hold it? And I think number one, too, is there's no right or wrong way to go about grieving. For some people, they may feel numb. For others, it feels like waves that come and go. Maybe you're fine for days, and then there's something that's a trigger. It just, every single person is different in the way they experience loss. And when I think about this man's losses, I'm not only thinking about the loss of his wife, but a lot of these secondary losses, the Parkinson's, his mobility, the way things used to be, his work, that maybe for men especially, their identity sometimes centers around. And so there's a depth of grief where it's not only about the loss of his spouse, but it's important to be able to mourn these other things. In particular, my focus of work at JFCS is overseeing bereavement groups. And JFNCS does run 2 groups for people who've lost partners. The majority of people in those groups are older adults. And I think that they're different than sometimes what people might expect. Yes, there's tears when people come to these groups. There's also so much laughter. And I think that there's this incredible relief in feeling like there is a group of people who understand, who absolutely feel that they've been having to mask in the rest of their lives, or they're upset about challenging things people say to them, whatever it is, but they can finally take a breath because they're in a space where they don't have to hide who they are, what's going on for them. We recently actually just started an in-person bereavement group. It was a shorter term one that was at the JCC. And what was amazing to me is people came for the group. And I think that they really, they thought initially, I'm here to just talk about grief in some way, and then I'll go home. But by the end of our 5th session, people were having coffee together in the lobby of the JCC, and staying later and laughing and exchanging phone numbers. And I think in a deeper way than sometimes we do when we meet a casual acquaintance, because they had shared photos of their loved ones, and really been able to talk about what was challenging in their life right now, and their sadness, and not have to hide it or mask it. And I think that these groups really offer an opportunity to learn about bereavement in some psychosocial sense, but also I think to have a place to put how you're feeling, and it not be on your children or other people in your life who may not want to hear it. So the goal, I think, always is to not expect that grief will end, but it's this shift in identity. How do we continue a relationship with our loved one, even if they're no longer here? We're still in dialogue with them in many ways. And now who do we become? Both because of their influence on our life and what they meant to us, and also because of the person that we now are striving to be because of it and working to be. Knowing that's not easy, it'll ebb and flow, but we continue to grow at all ages. So that's at least a beginning. So much.
Yeah. Melissa, do you want to jump in? You are a clinical provider as well, and maybe you want to address the topic of grief as well?
Yeah, sure. So, as Allison said, grief is not linear. That you can grieve, and it's normal to grieve, especially during times of holidays, and Mother's Day can be really difficult for people. But there is something called complicated grief, and complicated grief is when you have a prolonged, intense form of mourning that disrupts your daily life, and prevents recovery from your loss. And so that's really when you really need professional help. And a support group is great, but you probably also need to see a therapist who can help you through that. And it can be challenging to find a therapist. I know a lot of people, they don't know where to turn. They want to find a good match. And JFNCS actually has a therapy matcher that we can connect people to therapists, give them some suggestions. Mm-hmm. If you want to try and find a therapist on your own, Psychology Today is great. And you can also contact group practices. There are lots of therapists out there. So it's important to find one that is a good match for you.
Great. Well, thanks for the reference to our therapy matcher. That is actually through our service called Mental Health Connect. And we'll, give resources at the end as ways to find your way into that. So let me turn now well, first of all, I just wanted to acknowledge I am seeing the questions in the Q&A section, and we will get to those. So thank you for those of you who have put them in, and feel free to keep adding them as we go. But before that, well, let's talk about a little bit more about the Parkinson's specific issue that was named by the letter writer. And so, this is right in your wheelhouse. But can you talk about, strategies or supports, and more specifically, about helping someone stay engaged even as maybe their mobility becomes more challenging, And I think, this is going to feel familiar to a lot of people. It did certainly for me about balancing or encouraging independence with acknowledging real limitations and issues of safety. So, Anne, as I said, this is your wheelhouse, so maybe we'll start with you.
Yeah, thanks. I think it's a great question, really. And I think you picked up on an important point about he notices that it's getting harder to leave the house. So, this may be progressing. It is a progressive disease. However, having said that, again, I would question if he had a chance to address his own health and if he really had time to build a Parkinson's care team. I talk to people about having a movement disorder specialist. That's the neurologist who can treat their Parkinson's with specialization, but also physical therapy, occupational therapy, speech therapy, mental health support, and all of those things. And really, people are encouraged to treat them like anything else, like a dentist. You have a baseline, you have an evaluation, and then you have follow-ups because that way they can, understand where your challenges are, anticipate needs, and really try to keep you in the best shape possible to be independent. Um, and really, I think the other thing that's so important about living well with Parkinson's is learning to adapt. So, as an example about the socialization part, perhaps going out to meet a friend at a restaurant is more challenging. It's a busy time, it takes a lot of effort and time and energy and all of that. But could they ask the friend to get carry out and bring it to the house? Or could they have them in the house and instead of a three-course meal, just have cheese and crackers? It doesn't have to be an elaborate thing. So those adaptations can really be so key to living well and maintaining some of that independence. I'll also note that in regards to having therapy, therapists are wonderful. That we want to maintain your independence, to get you stronger. And so around the Boston area, especially, there are a lot of practices that utilize Medicare Part B, which allows them to basically bill for outpatient therapy in the comfort of your own home. So it doesn't require going out again. And it doesn't require homebound criteria. So that's a great option for them. As well as the community programs that we offer and many other places offer virtually online. So again, not so much effort to get out of the house, but still the benefit of having community, having exercise together, having social time. Um, and finally, I guess I would think about, he lives alone. So that's really something to consider. And I'm sure Melissa will talk more about this, but I always think it's good to have a two-pronged approach to continue to be active, to keep up those skills, but also to have support at the ready. Get used to having someone just stop by a couple times a week to help with that home maintenance that, I mentioned, things like that, and having that backup plan and support. So I'll let Melissa expand on that next.
Absolutely. Please, Melissa.
Sure. So, with Parkinson's disease or any disease, we don't know what the trajectory looks like. We don't know um, what's going to happen and what their needs are in the future, but we know they have needs. So I would say, is home the right environment for you? Is your house set up to age in place? One thing I do with a lot of my clients is I call upon Anne to come and do a home safety evaluation, and she's really good at it. She can find all of the possible trip hazards that exist in their homes. One simple thing she did for a client was put a hook up for their bag because they're always tripping on their bag. And she and her work has cut back on a lot of falls. I have clients who haven't fallen since she's been there. So it's really a worthy investment to have your home looked at. A lot of people want to maybe renovate their home when they could just put in a grab bar. And you want to make sure, is this a good investment for you, a financial investment? Maybe you want to have a realtor look at your home before you redo a bathroom. It may make sense to, do more simple fixes. And then, moving to a community is always an option. But first, I want to talk about home care. So home care, if you are resistant to having someone in your home, which a lot of people are, you may want to just try it out before you need it and have someone come in and help you just, with a couple of things before you really need a lot of help. That can be one way of kind of getting prepared for that step. You want to make sure that you have like a safety device if you live alone. We call it a purse, kind of like a button you can press and it can call the fire department if you fall. I can also wear an Apple Watch just some sort of tracker for safety. And going back to sort of congregate living, so there's assisted living communities, there are independent living communities, and there are continuing care retirement communities. These are all great options. A lot of people move into independent living and can get some help there. They often offer home care, and home care can come in. Assisted living, you share resources. There's caregivers in the building, and you have a care plan, and they come in and help you throughout the day or week, depending what your needs are. And a CCRC is a buy-in model, so you might put down, $300,000 to $500,000, but you get that back, like 90% back, to your estate, and you pay a less expensive fee per month. But assisted living is very expensive, so it's independent living and CCRCs. So it's an investment, and a lot of people are sort of nervous about that. So you want to talk to your financial planner and figure out, kind of if you have the money to do it. But there are, less expensive models too, which we can talk about. And the benefits of living in a community are that there's built-in socialization. There's meals, there's a chef that prepares your meals, which is amazing. And just even that informal socialization can be really helpful day to day, even if you're not a joiner or someone who wants to go to activities. Someone's at the front desk who can answer a question or help you with your phone. And you may encounter some kind of like assisted living consultants. They're out there, and they actually get a fee for the communities that you move into. So just something to note that, they may steer you in a direction that benefits them and not necessarily you. And something that aging life care managers don't get are any sort of benefit. We really want to make sure that this community is the right fit for you. And we don't benefit at all. It's unethical for us to benefit from where you move. So it's just something to note. And yeah, we pride ourselves on knowing all of the options out there and all the costs, and really which communities are excellent at any given moment.
Melissa, that was super helpful. Is there, you described, the differences between independent living, assisted living, and CCRC, continuing care community, retirement community, sorry. Are all of them the same within those categories? Are there variations between?
Yeah, so
Yeah.
some are independent living is usually just independent living. Assisted living also has memory care, and then continuing care retirement communities have all three. And the benefit of the buy-in is that you can move easily to the memory care and you pay less money. So it kind of covers some of the monthly cost, and it's a good investment for some people.
Yeah.
And some people end up moving out into another memory care. There's flexibility depending on what your needs are. And most people, I would say, don't want to live in a skilled facility. I didn't bring up skilled care, but for some people that is, an option. I know in Massachusetts, diabetics can't live in assisted living and have their insulin managed. It has to be managed in a skilled facility. So that can be an issue for a diabetic to live in assisted living.
Great. You've actually just addressed the issue that one person just put in the Q&A, or earlier put into the Q&A about the pros and cons of moving into senior living. I don't know if there's anything else that strikes you. You covered a lot there, but we can move on to other aspects of planning. I just wanted to note that that was one of the things that we heard in the chat or in the Q&A. So you talked about, planning for, if you've got a condition like Parkinson's, and want to, maintain some level of independence, acknowledging those limitations. I'm hoping that maybe you can sort of build on that a little further. It wasn't really explicit in the initial letter, but these issues were sort of very present for those who sent in questions ahead of time. We got a lot of questions on the very sort of practical but complicated and somewhat daunting issue of, planning. Considerations like the things of like how you're going to pay for care. You mentioned a couple times about financially you have to think about this. And I think people are sort of hungry for knowing a little bit more about how to pay for care. And also, somewhat related is how to make one's wishes known about their future health care. And and I'm going to turn right back to you, Melissa, to ask you how you help clients think about those kinds of issues.
Yeah. So I think the number one document, or number one and two, that you should have are healthcare proxy and a power of attorney. Healthcare proxy covers your medical decisions if you're incapacitated. And the power of attorney does sort of something similar for your financial decisions. And what people don't realize is that they don't have these documents in place. If you become incapacitated, then you may end up getting assigned a guardian through the court or a conservator for your financial. So, and that will happen without your wishes being known. And so having these documents in place, the healthcare proxy, you can go on the internet and download one in Massachusetts. You don't need a lawyer. For power of attorney, you probably do want to have a lawyer because it's financial, but it's pretty simple and people can do it in a low cost way. And then finally, advance directives. There's a MOLST form in Massachusetts. It's a Massachusetts medical order for life-sustaining treatment. You can fill that out with your doctor and go through sort of the list of questions. A lot of people don't want to think about it, but it is an important document, especially if you have a disease, a chronic illness, to kind of answer some of the questions. Do you want to have CPR? Do you want to have a feeding tube? It's something that can be monitored, edited very frequently, and it has to be signed by your doctor or nurse practitioner, or I think physician's assistant. It's pink. If you have a procedure in the hospital, usually they make you fill out one anyway. So definitely have that if you can. A lot of people put them on their refrigerator if they really have a strong belief. It's important for the EMTs that come to your house to know what your wishes are. And then a lot of people don't know the difference between Medicare and sort of long-term care, or even what Medicare and Medicaid are. So Medicare is a benefit you sign up for when you're 65. It covers like hospital or acute care. If you fall, you can go into the hospital, Medicare pays for that. You go to rehab, Medicare pays for that. You go home with some skilled physical therapy, Medicare pays for that. And then once you're discharged off of that, no, you're not using Medicare Part A. And then Part B is that supplement when you go to the doctor, any of the other healthcare you get. And then Part D is your coverage for your medication. So that's Medicare sort of in a bubble. Medicaid is if you don't have the funds to sort of pay for your healthcare, Medicaid will pay for healthcare. And that also kind of dovetails into long-term care. So long-term care, which are your activities of daily living, which is bathing, dressing, toileting, transferring, feeding, all of that is not covered by Medicare. It is covered by Medicaid a bit. So if you don't have a lot of money, Medicaid, there are programs that you can apply and get some, help at home. And those are mostly done through, they're called ASAP. So if you've heard of Springwell, Central Boston Elder Services, Minutemen Elder Services, those are sort of the organizations that cover those programs. Meals on Wheels, they do a lot of really great stuff. But if you have money, or have even just a little bit of money, you have to spend your own money on your care. And that means you're going to probably hire a home health aide, which costs up to $40 an hour or more. And you're going to have to pay out of pocket for assisted living, and that can run $7,000 to $14,000 a month. So, these are very expensive, choices that you have, things you have to pay for. And people, I think they save money for retirement, but they often don't think about the long-term care piece. And that's really expensive. So some people have long-term care insurance policies, about 15% have them. They cover different things depending on the policy purchased. Some cover assisted living and home care, maybe at different levels, different percentages. Some cover skilled. Some people have only skilled, only home care. So when you signed up for the policy, you picked riders Some have inflation riders, so their policy has gone up every year, and so their daily rate is a lot. Usually they pay out by daily rate. It can be anywhere from $200 to $500 a day. Most have a lifetime benefit of, 100,000 to $1 million. Some of these policies were very generous and people got them at the right time. Now they don't sell these types of policies because people live longer than they intended to. The insurance company intended them to live. And people also never lapsed on their insurance. So that's why they're not as available. But accessing these policies can be really challenging. You need to have a cognitive impairment or need help with 3 of the ADLs I mentioned. And so having a care manager, one of the things I do is help people access their policy and make sure that they understand what their coverage is. A lot of people don't use their policies because they're thinking, I'm going to save it. But I say don't save it. They have deductibles, which are usually like 90 days of care that you have to pay out of pocket. So you want to use it wisely so that you go through that deductible, as inexpensively as possible.
Yeah.
So yeah, they're great if you have one.
If you have one,
If
and
you
you
have
said
one,
only
yes.
15% of people have them, and there's some, limitations within them. So yeah, you can see why this is a really
Yeah,
big, important and troubling question for a lot of people.
it is.
Especially when
One
you
thing I didn't
price.
mention though is the moving process. So
Oh
there
yeah.
are also move managers that can help you move.
Hmm.
So if you need to pack up your home, you don't have to do it alone. That someone can come in and go through all of your stuff. Moving is a very emotional process. And so you want to make sure that you have help. And, these move managers can sell your items that you don't use, donate things, and even help set up your new apartment. So it's a really great resource and they can help sell your house. And one thing that didn't come up, but, going through your spouse's closet after they've passed can be a really emotional task. And so, having help, having an organizer, having someone come and do that with you can be great. And move managers do it, but so do a lot of professional organizers.
Yeah. Yeah. Thanks for mentioning that. Yeah. In a sense of cost of move managers, do you have a range in mind?
Yeah, I mean, they're usually like between $5,000 and $6,000, depending on how big the move is. If you have a lot of stuff, it can be expensive. But they also sort of organize the whole moving process and they will pack you up. You don't have to do anything. You can kind of sit
Yeah.
there, just point. It's great.
Great. Well, thank you for all of that. That was a lot. And just a reminder that we're going to be sending out the recording afterwards, so you can go back to that. And of course, we'll have some resources at the end for following up on anything specific. So we have time to, as I promised, to turn to a few questions we received along the way, as well as some additional ones we received in advance. So let me go to the first one that came in, which was about online dating for older adults. We talked about socialization. We talked about, social isolation, loneliness. This is a perfect opportunity to address that. And I wondered if any of you have perspectives or thoughts about what make for good options, or how one goes about even finding that out.
So I have helped people with their online dating profiles.
Do tell. Mhm.
Yeah, so online dating I think it's challenging at any age.
Mhm.
And I think you have to be very careful when you're online dating to make sure that the person on the other side is the person that they say they are. And you never want to give them any money or, share any really private information until you get to know them. But I think it can be fun to explore and see what's out there. I think for a lot of people, meeting people in person is really much more comfortable and something that they prefer. But if you do want to online date, do it. And just, I think for everybody, just try to know that people on the other side often feel like the computer that's between you is, is a very big gap and may not always be kind. So I would say, but try it.
Yeah, thank you.
You're welcome.
Um, uh, Somewhat related in the same vein around socialization, a person asked about lists of resources or groups online or in person to socialize with older people. People come to the senior center. I think they were naming the one in Newton, and others for different classes and activities, but not really to socialize. Um, uh, Aging alone, 1 hour a month. Oh, I think that was sort of like shock for aging, it's only 1 hour a month. Um, I don't know who wants to jump in maybe to talk about some of the resources. I know, Anne, you mentioned a couple of things. Um, do you want to mention a
Yeah.
few of those in more detail?
Yeah, I mean, things like, community groups, sometimes there are WhatsApp chats. If you talk to your neighbors, you might be able to get on those and find opportunities for, a block cleanup day or something like that. There's a lot out there. It's just a matter of finding it. And so that's why I like the senior centers because they have a great newsletter. But, you can go to the area senior centers. You don't have to stick to just the one in your town. Um, and I think, taking a class, trying something new, like if it's 5 weeks, every week in a row, you start to get to know people, you chit chat on the side. And, like Allison's example, by the time you're done, you start, saying, oh, could I share your email or have a coffee or something, and just the regularity of seeing these people I think is really important, because I agree once a month can be tricky for developing a relationship. It takes a lot of times to meet them. um, and volunteering, there's a lot of great opportunities to volunteer even at JFNCS, the family table program, friendly visitor programs, things like that. So yeah.
There's also Seniors Helping Seniors, which is an agency where you can, work with other peers who need assistance. And you also can get a companion if that, a lot of times people start out as caregivers and then end up having their own companion later on. That's happened. The agency's been around for like 12 years. So it's a wonderful organization. And they also have social built-in opportunities. They do a lot of programming for their employees.
Terrific. Thank you both for that. I'm going to turn to a couple of the questions that we received in advance as well. And in the meantime, if other people have questions, you can put them into the Q&A section at the bottom of your screen. So we got a bunch of questions that kind of relate to family dynamics, which we didn't talk about a ton here. We talked a bit in the last webinar. But I think it would be appropriate to ask these here as well. Somebody, here's one. Oh, actually, I'll just read a couple because they kind of, are on the same theme. So somebody said, what to do about elder parents who live in an old house, but who won't be told what to do. And someone else asked, the other side of it was how to deal with difficult adult children. Um, then going right back the other direction, how do you get a parent to adhere to your thoughts about their health when they're stubborn and resistant to change? And then back right again is how not to feel like a burden living with an adult child and her family. So we're getting questions from both sides of the equation, adult children as well as older adults themselves, worrying about the dynamics in their family. I would love to hear what our experts here have to say. I'm sure this comes up a lot in the work that you do.
I think an aging life care manager can be helpful in a couple of these scenarios. Um, Sometimes you need someone to kind of give you permission to get help. And hearing from an adult child isn't always something like the role reversal of, you're still my child, you shouldn't be telling me what to do, can come up, and a lot of feelings come up around that. And in terms of feeling like a burden, some children live far away and are really busy, have big jobs, or raising children. So having a care manager involved can help because, we can take you to appointments and help manage some of the things that can take your adult children away from their commitments. And it can help your relationship so that they, really focus on being your child and not necessarily your caregiver. And for some people that works for them.
Yeah. Anne or Allison?
One thing I'll add, thinking about all of this, is I think a lot about planning. Um, and this is in my own professional context, but the number of times people come to me to plan a funeral and will say, I have no idea what my parent or loved one wanted. Nothing, they left me nothing. I think one of the best ways to not both on both sides feel like you're being a burden or for a person to burden you is to plan, and plan as much as you possibly can, and to plan all sorts of things, right? Everything Melissa was talking about, advanced directives. I think funeral pre-planning is critical, and I also think it's not only the practical aspects of our lives that it's worth taking the time to plan. I think it's worth trying to sit down and maybe put those aside for a little bit, knowing that maybe those are sources of tension, and take a look at a tool like Five Wishes, or Cedars-Sinai Hospital has this great Jewish planning document that's actually about values and about storytelling. And maybe sit and try to take the tension sort of out of what's going on and talk about some of those things that are most important to all of you. And then maybe that's a way back in to the conversation, because then when you have a sense of what matters most, then you're able to say, let's figure out how to make that happen. And so I feel like those have always been the best scenarios when I sit with families, is that ethical sort of sense of what is my life been about? What is it that my legacy is? What do I want to give to my children, emotionally, and about what matters in the world? When you're able to have those conversations too, maybe it makes the other pieces a little easier. It's imperfect, but sometimes.
Thanks very much.
Yeah, I would agree with that totally. I mean, I think it's a lot of just trying to see the other's perspective. The adult child may be juggling a career and family of their own. The older adult parent might be, just having a different perspective on their life and trying to make meaning and think about bigger picture issues and not so much the day to day. And so just trying to be more thoughtful about having these conversations and where are they coming from and trying to get at the root issues, because I think, people are well-meaning in general. They care. It's just hard to know how to express that sometimes, and it can be frustrating.
Yeah. Thank you all for that. I was reminded a little bit about what you said, Melissa, about the value of having sort of a third party, like an aging life care manager, to help. And I have the note on my table over there, but I'm not going to go off screen to get it right now. But it was a thank you note to one of our other aging life care managers, from somebody whose mother died, I believe, 2 to 3 years ago, and they were still thinking about the help that they got, and they said, thank you for doing the work so that we could focus on the feelings. So it was like a little bit of a divide and conquer of, so to take some of the tension off of the relationship, by bringing in another person. So thank you for that. We have a couple more minutes. There was a question from someone in the chat. I'm wondering if Anne can say something about the Parkinson's Foundation as a resource.
Yeah, I mean, so we're very lucky here in the Boston area, but just in general, there are a lot of great, wonderful organizations around Parkinson's. I think the biggest ones are the Parkinson's Foundation and the American Parkinson's Disease Association. But of course, many people are familiar with Michael J. Fox, Brian Grant Foundation, Davis Phinney Foundation, and even more, PMDA. So there are a lot of wonderful resources for information out there, but it is nice to find connections with the local chapters of these. Many of them have a fundraising walk. There was one for the APDA last weekend, and then the Parkinson's Foundation has one again in the fall called Moving Day. So there's a lot of great opportunities to come together as a community and raise money for research and community programs if that's something someone is interested in.
Yeah, and I know, you work these, and so
Yeah.
along with many others, it's
Yes.
full of resources.
Yeah, there's great
Um,
tables up for community partners to share what they do and to network. So yeah, it's a great opportunity.
That's great. I think we have time maybe for one more, and I'm just going to go back to the questions that we received here. We had the whole bench of family dynamics. There was a question from somebody that kind of related to the issue of solo aging. So somebody wrote, I'd like to hear about the specific challenges of aging when one hasn't had children or grandchildren. Is there anything that either you would lift out from what you've said earlier in the webinar, or add to what you've said that's sort of specific to someone who's aging on their own? And anybody can jump in.
Yeah, so I have many clients who are solo agers. There's actually kind of an organization, like there's people that kind of just kind of focus on that population, um, and care navigators that do what we
Mhm.
do. So I think it's really important to identify people in your life who you can, ask, can you be my healthcare proxy? Will you be my healthcare proxy? And having that conversation um, can be scary, but I think it can be an honor. Um, and think about your neighbors. I've seen neighbors step up and be healthcare proxies for people in power of attorneys and not even know them that well. I
Mhm.
see wonderful relationships every single day, and I'm always shocked by how people step up for others.
Mhm.
So yeah, I would say you need to have help. So whether it's you have a professional that does it or you ask someone to do it. Um, you can also go to your senior center and ask. Lawyers can act as, power of attorneys. So there are a lot of people out there that can help, and um, you're not alone.
Yeah, yeah.
I would just
Um,
tag briefly
thank
that,
you.
I was part of a grant through the Parkinson's Foundation that had three components, which really kind of summarizes what we're talking about here, which is that for solo agers with Parkinson's, there was a social aspect of them getting together and going to an art museum and things like that together. There was a care management consultation and there was a home safety evaluation. So we're looking at independence, future planning, and socialization. And you can get those from other resources as well, but I think those components really tie it in nicely together.
Mhm. Great. So a lot of the same things that we have talked about, but maybe a stronger emphasis needed on the advanced planning, which we've talked about a lot here tonight. So thank you so much. I want to close this out since we only have another minute. First, close this out by saying thank you so much to Allison and Anne and Melissa and to all the folks that were able to join us tonight. If you've listened tonight and you're thinking this is me or this is us as our family, and I just want you to know that you don't have to figure it out alone. Services for older adults here at JFNCS can really help you think through all of the different issues we talked about tonight around loneliness, around health, around Parkinson's specific or Parkinson's issues specifically, family communication, all the planning especially. And we can help you connect with resources that fit your own specific situation. So actually, if Shira, you can put up that you have it up already. There we go. The slide for Senior Direct. So your first stop at JFNCS should be Senior Direct. It's our free information and referral helpline. It's staffed by incredible elder care professionals from JFNCS who take the time to really sit and understand your question in order to connect you and your family with the resources and expert advice you need. And whether that's going to be something here at JFNCS that we can offer you or things out in the world. And there are many. We're fortunate here in Massachusetts in a lot of ways. Lastly, or second to last, keep your eyes open for future editions of Ask Edie, when we'll be taking other aging questions and addressing them through experts here and elsewhere. And then finally, we hope that you'll take a few minutes after this to complete a very short survey about tonight's program. It'll pop up on your screen right after our conversation ends. And with that, I'll just say thank you again. Thank you again to our aging experts and to all of you, and have a wonderful evening. Bye now.